My name is Av Rios and I'm a paramedic with Lansing Mercy Ambulance on behalf of Expert Village. In this clip, we're going to talk about checking for a pulse. In an unresponsive patient, the place where you want to check for a pulse is called a carotid, which is located right here. You can find that when you have the patient extended, you can kind of feel some of the muscles that extend out to the side of the neck, and you can feel your trachea midline. What you want to do is, by finding the muscles, sliding your hand, once they fall in the crevice in the middle, that's where you locate your carotid pulse. The importance of checking for a carotid pulse rather than a radial or any other location is it's more accurate. Your pulse is just a matter of what your blood pressure is systolically. What that means is you can actually still be alive, your heart can still be pumping, but if your blood pressure isn't high enough, you won't feel the pulse. Your radial pulse, for example, too distal. Once your body starts to shut down and your blood pressure drops, your body then shunts blood away from your extremities and keeps them in your core. So therefore, you could go to feel for a carotid pulse and not, or radial pulse, and not feel one, and it will be the patient is in cardiac arrest, but in all reality, their body has just said that it doesn't want to give blood to the extremities, it'd rather give it to the core. So you want to give the carotid pulse because that's the most accurate, which can read as low to 50 to 60 for the systolic blood pressure. When it's below that, even if they still do have a heartbeat, it's important that you give CPR. On this patient, the time you want to check for your CPR or for a carotid pulse is after you've opened the airway and you've checked for 5 to 10 seconds. You then want to find your location and assess that, not pushing too hard. If you push too hard, you can actually occlude the vessel of the artery and you won't feel anything. So you want to give a kind of just a gentle pressure, just enough to feel. And when you do that, you want to feel for 5 to 10 seconds. It's important to never check with your thumb. By checking with your thumb actually has its own pulse. So by pushing on something with your thumb, it's common for people to feel a pulse when in all reality they're just feeling their own pulse from their thumb.